My name is Dr. Michael Goodstein. I'm a neonatologist at WellSpan York Hospital. I'm the director of the York County Cribs for Kids program, and I'm a member of the American Academy of Pediatrics Task Force on SIDS. October is SIDS Awareness Month, and this gives us an opportunity to reflect on the tragedy that befalls families from this terrible problem. And it gives us an opportunity to provide education for our community to help protect babies so that we don't have as many of these tragedies in our communities. So, today I'll just kind of lay out our speaker panel for today. Mayor Halfrek will be speaking first and providing us with a city proclamation about SIDS. Pam Gay, the county coroner, will be speaking from her perspective of what she sees and some of the progress we've made over time. Dr. Matt Howie, who is a family physician for WellSpan and also the medical director for the City of York Bureau of Health, will be speaking of this from a public health perspective, and then I will finish up the press conference with some discussion about tips for parents and a story about how this can really happen to anybody. Afterwards, we'll be available to take questions or talk about if you want to have interviews at the hospital with perhaps a new mother and what she's learned, we can arrange for that as well. So I will turn it over to the mayor.
Thank you. This is a topic that is really important to me, and is one of those things that sometimes you just get a kick to the head that says, "Hey, you're not as smart as you thought you were." So I have a baby daughter, 3 years old. She just turned 3, and she was born really small. That's why I call her Super Lily, because she's more for her little package than you might expect. She's really beautiful, but she was born very small, and there's a difference. I consider myself fairly intelligent, but that doesn't mean I'm knowledgeable. We all have to understand that you can be really intelligent, but not have pieces of information that are crucial, and that's what makes today so important. I was in the hospital with my little daughter, just a couple days old, and I was sleeping with her on top of me on the couch, right next to her mother, and I'm in a hospital. I'm in what you'd think is one of the safest places, and I'm doing something absolutely horrible that I didn't even realize, and they didn't even teach me there, which. We've got to do better in the hospitals too to make sure that everybody is getting educated, and there's a great program that is going to be discussed here in a little bit about how they're educating the new moms. But even when I went home, I would let my daughter sleep on me when I was on the couch. And then that kick in the head moment was that a baby is 70 times more likely to die when sleeping on the couch with a parent than when sleeping in proper conditions. Not 70%, not 7 times, 70 times more likely. And you're the loving parent, and you're putting your own child at risk because you didn't have that little piece of information. So I want to ask people to really pay attention to the information that is shared today. Also, make sure that any moms out there or any pregnant mothers that you reach out, and if you're not getting the information, make sure you get every piece of information about sudden infant death syndrome. The United States, while we spend more on healthcare than probably anybody else in the world, we have one of the highest infant mortality rates of the industrialized countries in the world. It doesn't make any sense. And information and education is the solution to this problem. So I want to thank you all for bringing this to our attention today. And it is my honor to bring you this proclamation from the City of York on National Sudden Infant Death Syndrome Awareness Month, October 2018. Whereas each year, sudden infant death syndrome, the sudden and unexpected death of apparently healthy babies, is the major cause of death of infants between the ages of 1 month and 1 year. And whereas recognizing SIDS Awareness Month will provide us with an opportunity to increase our understanding of the great tragedy involved in the deaths of newborn babies, and whereas SIDS Awareness Month enables us to consider how, as individuals and communities, we can meet the needs of bereaved families and work to prevent the causes of sudden infant deaths. Now, therefore, be it resolved that I, Michael R. Helfrich, Mayor of the City of York, Pennsylvania, do hereby recognize the month of October as National Sudden Infant Death Syndrome Awareness Month, and I urge parents, caregivers, and researchers to unite with governmental, business, and community service organizations to bring about a greater public understanding of the prevention of this tragic syndrome and hasten the elimination of sudden infant death syndrome. Given under my hand in the seal of the City of York, this 11th day of October in the year 2018, Michael Helfrich. Thank you, sir.
Thank you.
Hi, I'm Pam Gay, the York County Coroner. I want to thank everybody for being here today to help us raise awareness about this very real problem, very sad situation that we come across in the coroner's office all too often. Thankfully, we've made some tremendous progress in the last 5 years since I've been coroner. We are active with the Cribs for Kids. Dr. Goodstein has been wonderful about helping us get the message out, and we really want to keep getting that message out, even though things are improved and our death rate is down from this terrible what could be considered an epidemic, but is much better now in York County. Any loss of an infant or a baby's life is definitely tragic, let alone something that could be so easily preventable. And so that's something that we really try to get across when we educate in the community. But I just wanted to just touch base on a couple things that we see with some of these situations that we want to make sure that people are aware of. One of the things that I have been focusing on this last year in our office is trying to get the caregivers educated, not just the parents, but the caregivers. Sometimes they're left in the care of somebody who maybe doesn't really get that message clear with the parents as to how they're going to handle sleep when that child naps or when that child goes to bed. It's important that parents get that message across to their caregiver very clearly, that certain safe sleep recommendations, such as being alone, being on their back, and being in a proper crib. Those are the things that we really want the caregivers to be aware of. So many of these caregivers mean well, but sometimes they are generationally continuing practices that they've been doing, with their children or with their children's children, or as grandparents. And so we want to make sure that message gets across to the caregiver, that the parents make that very clear when they are leaving their child in the care of a caregiver, what they can do to make sure that sleep is proper. The parents should be providing that caregiver with equipment if they don't have it when it comes to the portable crib that's approved and so on. And making sure that there's no bedding in the bed, that they're in a sleep sack or at the very most a light blanket, and that there's no toys in the bed. One of the other things that we see sometimes is these memory foam mattresses. We try to make sure that the parents and the caregivers know that they can conform around an infant's nose and mouth and can actually cause them to not be able to breathe. And definitely the co-sleeping element. We stress that over and over again, how important that is. It is so difficult, these cases, because the families are so guilt-ridden, especially if there's been co-sleeping going on. And it's, very, very, very tragic to work with these families. And one of the things that I heard in a presentation a while back was, you may have a sleepless night because you have to sit up with your child and you're trying to console them versus laying in bed with them. But in the long run, wouldn't you rather have a sleepless night than have to go to their grave? And so that's, as morbid and sad as that may sound, we try to express that over and over again to our families. when it comes to the proper equipment, one of the things that we still see occasionally are the drop side cribs, which I actually used to use, I confess, in the days when those were okay, or they thought okay and realized that they were actually quite dangerous. And we've actually had a death recently in the last couple years where an infant got caught between the bumper pads, which are also a no-no, as pretty as they are. They should not be used during that first year at least, and got caught between the bumper pad and the slats of a drop side crib. So that was very tragic. This child died, and his mother was in the very next room the whole time and never heard any of it going on. Again and again, we see some tragic things, but thankfully the message, I think, is getting out there. We're seeing a decrease in these deaths, and we just want to continue that message. It would be wonderful to have a year without any of these deaths, and we're hoping that we get to that point. So thank you again for helping us spread that awareness.
Good morning. I'm just going to echo some of the statements that were made earlier. Again, I work at the York City Bureau of Health, and one of the key things we try to do is echo messages that are core messages that are being used in different environments. Dr. Goodstein does amazing work in the community in raising awareness to this issue. But there's a period of time before a mom delivers a baby, and there's a period of time after the mom delivers a baby where they're not in the hospital. And trying to get that message echo and resonating within the medical community so that message is getting out to moms, to grandparents, to other caregivers is a really critical element for us in terms of responding to this. We have a program, and there's a number of home visitation programs that have taken the information from the Safe Sleep Initiative and have echoed that information during the period of time when the mom is pregnant. And then after the hospitalization, when the child comes home, we echo those with visits as well to reinforce the message of safe sleep environment. This is really a critical thing. If we want to improve outcomes, and I'm always a little bit humbled when I take a look at the how much we spend on healthcare and how poor our outcomes are. That was kind of discussed earlier with Mayor Helfrich. This is one of those areas where we can do better, engaging families before and after the delivery of the baby, and making sure those messages that are being made in the physicians' offices and the providers' offices are reinforced in the home and in the community in the messaging that we put out there. It's definitely exciting to me to hear that the rates have improved, that the message seems to be getting out there, but our work is not done. This is going to be a message that as long as babies are going to sleep, we need to make sure the environment in which they're sleeping is safe. So thank you for the opportunity to be here and to echo those messages as well.
All right. Thank you, everybody. I'm just going to finish up with some information and recommendations for parents and provide you with a little bit of statistics and some of the things that we can do. But the first thing I want to just acknowledge that parenting is hard. It's really a tough job. It's the best job in the world. It's the hardest job in the world. And we know every parent wants to do the best they can for their baby. And as providers, as public health officials, we want to help. We want to partner with families, not just the parents, with the extended family and caregivers, because we know parents know best. And we want to give them the information to help them make the best decision. So we're going to review some of those recommendations. The recommendations for safe sleep are until the first birthday, and these are determined by the American Academy of Pediatrics that reviews all the research and literature and then comes up with consensus information on best practices. If we won't be able to go over everything here today, but if people do have questions, they should talk to their provider or go online and find safe sleep information. You can find that at the Safe to Sleep campaign from National Institute of Health or at the Cribs for Kids website. Be careful about what you look at. There are studies that show that up to 50% of the information online may not be accurate, so be careful about your sources. So as Dr. Howie was saying, preventing SIDS really starts even before conception. So being healthy before you have a baby, and there are things that you can do prenatally that are really protective. So having a healthy baby, getting good prenatal care. If you're not in an intensive care nursery, premature babies, low birth weight babies have higher rates of SIDS. So having a healthy baby is really important, so good prenatal care is essential. And one of the most important things that women can do during pregnancy is not smoke. We estimate that a third of all SIDS cases would disappear if mothers didn't smoke during the pregnancy. The chemicals in the smoke, there are other chemicals and alcohol and drugs that the fetus gets exposed to that alter brain development and make the baby more vulnerable to SIDS after they're born. One thing you may not realize, something you do for safe sleep is to breastfeed your baby. Okay, breastfeeding has all kinds of benefits. It decreases the risk of infections. There are some studies that suggest it improves IQ. There are many, many benefits to it, but one of the biggest benefits is it reduces the risk of SIDS. If you breastfeed your baby for 2 months, the risk of SIDS is cut in half. So that's a really important thing that any new mama can do. If you're going to breastfeed, though, it's important to do it safely, because we know that when you're breastfeeding, you get sleepy. And so, as Mayor Helfrich mentioned, we don't want you breastfeeding on the couch, because if you fall asleep on the couch, the risk of death just increases astronomically. So if you're going to do that breastfeeding at night, we prefer you do it in the bed, but make a safe sleep zone in the bed. Move the pillows out of the way. Don't have any loose comforters or things like that. Maybe use a timer to remind you if you start to fall asleep that it's time to switch sides or put the baby back in their crib or bassinet. Back sleeping is one of the most important things that we can talk about as well. We really were stagnant with our rates of SIDS and these accidental suffocation deaths in this country for years and years and years, despite all things we tried. But when the Back to Sleep recommendation came out in 1992 and the Back to Sleep campaign started in 1994, we saw a 50% reduction in the number of deaths in this country. This is probably one of the most successful public health campaigns that's ever occurred in this country during the late 20th century. So back to sleep is important. Some parents do worry a little bit about putting their babies back to sleep. I can't show you this here because the picture's a little bit small, but I'd be happy to show you this later. And the images, when babies are laying on their back, people are worried about the babies choking if they should spit up. But what you need to know is when you're laying on your back, your airway is higher up, and your feeding tube or esophagus is lower down. And gravity pushes fluid to the lowest point. So if you're laying on your back and you spit up, you swallow what you've spit up, which may sound kind of nasty, but it's not harmful. However, if you're sleeping on your tummy and you spit up, now the lowest point to gravity where the fluid is going to go is your airway. And so it's really the babies who are sleeping on their tummies that are going to be more at risk. As a matter of fact, we know that sleeping on the tummy doubles the chance of a baby dying of SIDS. Okay, another thing that's really important for families is to maintain a safe sleep environment. And this is an example set up right here for you. So a pack and play or play yard, a bassinet, crib that's been approved by Consumer Product Safety Commission are the things to use. And basically, you want an uncluttered crib, on anything in that space. So there should be no bumpers, no pillows, no loose blankets. Babies, all they need in terms of what they wear is enough clothing to stay warm, whatever number of layers. A parent is wearing one more layer for the baby is all you need. We don't want them wrapped up in lots of blankets. When babies get overheated, they have a higher risk of SIDS. If these things get loose, many of the deaths that we see, the babies have their nose or mouth or face covered from the blankets, hats, and other materials that don't belong there. So an uncluttered environment is really key. And another important thing is, like as Pam mentioned, and some of the things that she's seen, when babies are kept in a separate room, it increases the risk. So we want mom and babies to be close together in the same room, not sleeping in the same bed, but sleeping in the same room. Then you can attend to the baby's care. You're more likely to be successful with your breastfeeding, which is so important, and it's going to reduce the risk of one of these accidental deaths. So, the sad truth is that we have about 3,600 babies dying in this country every year before their first birthday due to sleep-related deaths. If you do the math on this is one baby dying every 2 to 3 hours of every day of the year. It is a national tragedy, and we need to do better, and that's why we're here today to discuss these things and allow parents to make best decisions to keep their babies safe. In Pennsylvania, we lose over 200 babies a year. And if you do some math, we had 121 babies in 2016. That's the latest year we have data for. If you do some math on that, that's 6 kindergarten classrooms that are empty, silenced forever, okay? Parents should be going to visit their babies at the schoolyard and not have to go to the graveyard. I want to share just one little story for you before closing out, and that's this book that's called Sleep Baby Safe and Snug. This is a book that we give out to every family before they go home from the hospital. Okay. And this book, sorry, was developed by Charlie's Kids Foundation. And so Charlie's Kids Foundation came about from a couple, Dr. Sam Hankey and his wife Maura. And they are just lovely people. To be honest, I wish I did not know them, because the only reason I do know them is because this foundation was started in Charlie's honor, in his memory, because Charlie died. And what happened was, one day Dr. Hankey came home. He was in his training in Cincinnati to be a pediatric cardiologist. And he came home a little early and decided to take a nap with Charlie on the couch. And as Mayor Halfrick alluded to, the tragedy hit this family. As Maura says very, very clearly, Sam got up and Charlie didn't. And so at 1 month of age, Charlie died. To honor his memory, they started this foundation, and they had this book made by Dr. John Hutton, who does medical education in children's books. It's a beautiful, susical, lyrical story. It's always great to read to babies to help their brain development, but this story has embedded in it safe sleep messaging and all the do's and don'ts on the back. So whenever I send a family home, and actually every family that goes home from York Hospital gets this book and a discussion about safe sleep, because it's such an important message. Because we know the most common cause of death in this country for infants between 1 month and 1 year of age are the sleep-related deaths. The message that I take home from this book, I take home two messages. One is, if it can happen to a pediatrician, this can happen to anybody. So don't think that it can't happen to you. Unfortunately, or for what it is, SIDS is an equal opportunity killer. It doesn't care about the color of your skin. It doesn't care about the color of your hair. It doesn't care how short or tall you are. It doesn't care how much money you make or how fancy your car is. It can happen to anybody. It doesn't care how much you love your baby. Love will not make this go away. The way to make this go away is by being knowledgeable and keeping your baby safe. And that's how we can protect our babies and reduce the number of deaths in our community and in this country. I'm also happy to say that in WellSpan's commitment to safe sleep, in addition to these books, we are going to start, just as the city has developed these nice onesies, which have this side up and turn me over if you find me this way. WellSpan has committed to developing a similar messaging, and in sometime in the future, in the next year, we should start giving these out to every family as our commitment at WellSpan to promoting safe sleep in the community. So I thank everybody so much for your time today, and we'd be happy to take any questions formally or individually afterwards. So thank you. Helen, yeah, sure. Helen, come. What? Come up for a second. No, that's great. Please come on up.
No worries.
Helen Lehman.
I'm Helen Lehman. I'm with Safe Kids Coordinator, and in partnership, we run a program for any mother, any family that finds economic difficulty, that they can't provide a safe place for their babe to sleep. We do a Cribs for Kids program. It was started to be funded through our auxiliary, and over the years we've been supported with grant funding to provide this cribette to any family who needs one. Along with the cribette, we provide a sheet and a sleep sack. So please get the word out. We do education every Tuesday. We run classes, so please share that if you run into any family who doesn't have a safe place for their babe to sleep, please contact us. It's all free services, and we want safe babies every single day, every single night. Thanks.
And how and where do they contact you?
I should have brought, they can call WellSpan number, and they will direct us for the Cribs for Kids program. And
Melissa, do you have the number?
do you have the number?
They can call 851-2613.
All right.
Can you repeat?
Just say that into-
851-2613. And otherwise, you can go online and look for Safe Kids York County, and our toll-free number will direct you also to the program.
And also, you can talk to your provider. Anybody who's getting prenatal care, they can talk with their provider, the social worker, all the obstetrical groups, the family practice groups, a lot of the charitable organizations in town. They all know that if they have a family in need, they can make a referral to us. And there's a whole procedure to go through, but it's fairly simple
Right.
because we want to make sure that every family has a safe place for their baby to sleep.
Right. One of the tragic things that we see sometimes is, and I wanted to bring this up and I forgot, is we'll see that crib actually, or something similar, in a corner of a room and not being utilized. So we really want to make sure that people understand that this is the only safe, approved way, in certain cribs that are, approved, that you can put your infant to sleep. And so many tragic situations where we've seen the pack and play. Maybe they just got it a couple days before and they weren't using it yet, those kind of things. So.
Great. Are there any questions? All right. Oh, yeah.
Nationally and regionally, are the numbers up or down, and what do you account for?
Sure. No, that's a great question. So with the back to sleep messaging and campaign, we saw that 50% reduction. That kind of tailed off in the early 2000s. And then the statistics actually get kind of interesting because we continue to see a decline in SIDS, but the overall rate of these infant sleep deaths did not change. And so what's happened is we've seen an increase in suffocation and strangulation deaths. In the early 2000s, there's about a 30% increase in those deaths. And we've also seen an increase in the number of what's called undetermined deaths, where they can't decide if it's SIDS or suffocation, so they just leave it as undetermined. So one of the problems is that we've always thought that the back to sleep messaging was kind of low-hanging fruit, but it's not as low as we think it is. There's a study that was done by Dr. Eve Colson when she was at Yale University in the last year or so that asked parents how they position their babies to sleep. And although 75% of people said they put their baby on the back to sleep, only 50% were doing it every time. That's a really critical piece of information because you have to be consistent with what you do. One of the dangerous things out there is that when babies are accustomed to sleeping on their back and then somebody puts them on their tummy, then the risk of death increases 20-fold. So it's really important that we get out to the grandmoms and other people who may be watching, because then if you have this unaccustomed tummy sleeping, it's a dramatically increased risk. We are doing all this work in the hospitals and elsewhere to try and get more messaging out, but it's really kind of been a little stagnant around 75%. If we could get everybody having their babies on the back to sleep all the time, I am certain we would see another significant drop in the number of babies dying in this country. So it's a good question. Thank you. All right, well, thank you very much for your time. Thank you, Mayor. Thank you all for being here, and we'll be up here to take questions. Thank you.